Hi, folks. My name is Dr. Amy Pearlman. I'm a board-certified urologist with expertise in sexual, hormonal, and genitourinary health. And I acknowledge that a big barrier for a lot of men coming in for a consultation on penile girth enhancement is simply not knowing what to expect during that visit. And because it's a topic that we don't commonly discuss, that can be barrier enough to keep someone out of the office. So why don't I take you behind the scenes a little bit here and give you the scoop, the inside scoop on what we may discuss. Now, what you need to know in terms of expectations with filler. Well, a couple of key points here. The filler that I use is hyaluronic acid, and it's a commercially available product. I use Revenese Versa, so it comes out of a box that looks exactly like this. Take it out of the box. And each one of these bad boys right here is a unit or a syringe, and it has 1.2 milliliters in each syringe. So there's the filler in here as well as a little bit of lidocaine. So I use Revenese Versa. It is a temporary filler, so it's important to know that I am not using any permanent fillers. I tell my patients, sure, the idea of a permanent solution for girth enhancement sounds really great. The problem is with any permanent solution is with permanent solutions come potentially permanent consequences. So the big thing when it comes to filler for my patients, I find that, nearly every single one of my patients, they're coming in, they know they have a normal sized penis, they just want to enhance their penis, and the last thing they want to do is regret a decision they made for a very elective procedure. So they, obviously want to improve their confidence and like what they see, but they don't want to hurt themselves. And I am very risk averse. So whenever I'm thinking about offering a treatment or a procedure for patients, it's one thing if something is very effective. We all like effective treatments, but if I can hurt someone in the process, and more importantly, if I can't fix what I've done, that is a problem. And we know from some of the more permanent solutions, including permanent injectables, is that if there's a bump or an infection or scar tissue, it is much more challenging to address compared to temporary fillers. So I'm very risk averse. I'm looking for the safest option on the market. And to date, what we know from my own personal experience and from published research is that really the safest option on the market when it comes to girth enhancement is going to be a temporary filler with something like hyaluronic acid. Okay. So that is something here to keep in mind. Not all hyaluronic acid products are created equal. I always show my patients that I'm taking them out of a package. So it's not just a random syringe that I'm injecting. And also not hyaluronic acid products are created equal in terms of, how firm they are. So the one that I use is, it's not particularly firm. It's soft. So like when you feel it, it just feels like tissue. It doesn't feel abnormal. And even when you might wonder, oh, well, when the penis becomes erect, will it just feel softer? And it really doesn't. I really haven't heard that from patients because the erect tissue will push against that filler and the penis actually still feels and looks erect. Okay, so other things to keep in mind is that with the foul fill protocol, we don't inject all the filler at once. On average, people can get about 1/4 of an inch to 1/3 of an inch increase in girth with each treatment session. And on average, each treatment session, we're going to be injecting 4 to 6 units. So that's 4 to 6 of these syringes each session. Now, they've done 3 very well-designed studies outside the United States looking at the injection of hyaluronic acid for girth enhancement. And on average, they injected about 20 units or 20 of these syringes at a time and followed patients into the future prospectively. And they had really good outcomes. However, I do follow the foul fill protocol. And under that protocol, we're really limiting the amount of hyaluronic acid we're injecting each time. And the value of spreading it out into several sessions versus one full session is if you put a whole bunch of filler in at one time and the filler moves, then you have to do a lot of correction, and that can cost a lot of money. So the nice thing about doing just a few syringes with each session is with each subsequent session, if there are areas, the penis moves, right? And so it'll expand, it will retract. And so some of that filler is going to move while the person is healing, although we do have some ways of minimizing that movement. We can course correct and we can even out the filler with subsequent treatments. So one of the nice things about using hyaluronic acid is we can easily dissolve any of this medication with a medication or an enzyme called hyaluronidase. But it's rare that I actually have to use that medication, because when we're doing a couple units of the hyaluronic acid with each session, I'm able to even things out. So by the time I'm done with injecting the filler, the penis is looking pretty even. So it's rare that someone says, oh, I still have, unevenness that I need you to correct. So I'm typically going to inject the filler until I'm getting the person to their girth goal, and then deciding if we need to even anything out with the hyaluronidase, although that's pretty rare that I need to do that. So that's the advantage of breaking this up into several sessions. The other thing is, after that first session, your body is going to develop a capsule, around that filler. And so with those subsequent filler sessions, we're able to inject directly into that existing capsule. And that also helps keep the filler where we want it. And then what I talk about with patients is, expectations for how long the filler may last in the body. And the short answer is we're not really sure. We're still trying to figure that out. In general, when we use the same filler, which, by the way, we're using off-label in the penis, it is not FDA approved for the penis. It is approved for some facial indications, but we're using it off-label in the penis. So that's very important for people to know. I've never had a single person say, oh, it's not FDA approved in the penis, so I don't feel comfortable doing it. Like, people understand that we have great safety profile for using this product in the body, in the face. And our own work, even though it's not FDA approved, just does show safety and efficacy in the penis, and patients are, fine with that information. So what we know from filler in the face is that if you put it, let's say, like in the lips, it will last up to 12 months. Now, it doesn't mean that if I were to put, filler in my lips, that my lips would be plump for, 11 months and 30 days. And then all of a sudden, after that, the filler goes away. This is a gradual process of your body reabsorbing that filler. So it's really the same thing for the penis. There are some patients that will get, Botox in their forehead, and the lucky ones are ones where the Botox will last, 6 months or even longer than 6 months. And then you have other people where you put Botox in the forehead and you start seeing wrinkles at 6 weeks, but it'll kind of last up to 3 months. So everyone is a little bit different in how quickly they metabolize whatever injectable that you're using. And it's certainly the same thing for the penis. What we know is that, just anecdotally from patients who have had this procedure, starting several years ago, is that the filler may last in the body for up to 4 to 6 years. Now, the foul fill protocol is relatively new, and there was a study that we looked at retrospectively, so looking backwards on patients who were already treated between 2000 and 2023. Now, this study specifically was really a safety study. So it was looking at 471 men who had the procedure done at the Dallas foul fill clinic. We were looking at safety of the procedure. And out of these 471 patients, only 2 patients developed superficial infection, treated with antibiotics. Importantly, these were men who were non-compliant with the post-procedural protocol and ended up having sex too soon. So I've never seen, for my patients who follow the protocol, who just have hyaluronic acid in their penis, I have never seen an infection in the penis. So that's really important to know. And in the group of 471 patients, none of these guys reported worsening erectile function, worsening sensation. And so they really tolerated this procedure well, and it's been shown to be a very safe procedure. But what we're trying to figure out with some of our research is how long this filler lasts. And so the thought is that it probably lasts about 12 to 18 months. And I want to explain why it's difficult to answer this question, because I anticipate that a lot of you are wondering, well, why can't they just figure out how long the filler lasts? When patients come in for filler, the protocol, while we have kind of like a set protocol, not everyone is going to follow the protocol exactly. So there are some patients that I see who will come in for their initial session, and then they'll come in like clockwork every 3 weeks until they are at their girth goal. And so they'll usually come in for like 4 sessions every 3 weeks and then be done with it, right? And then I have other patients that will come in for their initial session, they'll get good improvement, and then maybe they're traveling and they decide they want to come back in 6 weeks and then maybe 3 months later. So not everyone is on that same protocol. And when patients are coming in for their follow-up, we're checking their measurements. So we're measuring the penis length and girth prior to injecting the filler. But if we don't see them back for, let's say, 3 months, we actually never know what their final measurements are after their treatment. Right after we put filler in, meaning like I have them in my procedure room, I put filler in, I don't measure right after the filler because that's not where they're going to end up 3 weeks later. There's some swelling in the penis. I just injected some, local numbing medicine to help create the space for the filler. So that measurement is not going to be where they're at in 3 weeks. So that's one of the challenging parts as well. And then the third piece that makes it a little bit challenging is patients kind of come in at random times. They're coming in from out of town. It's easy for them to fly in. They want to stop by the clinic, get some maintenance filler. So sometimes I have patients that drop in once a month, once every 6 months, depending on their schedule, what their interests are, if they have time off from work to get more filler. So it's a little bit challenging to know exactly how long it lasts. With that being said, I have yet to be surprised by filler going away and not anticipating that, except for one patient. I have one patient who had filler by someone else before he saw me. It was same thing, hyaluronic acid. And he said he got noticed additional girth, and then he just ate it up and his girth went away fairly quickly. Then he saw me, I did the procedure, he got a great result. And it wasn't soon after that he noticed that he really, lost significant girth. But that's one patient out of many patients that I've seen. All the other patients that I've seen, they've gotten the girth that we anticipated they would get with the number of units that they purchased and I injected. And when they come in for their maintenance treatments at sort of random times, they're maintaining their filler fairly well. And so neither I nor my patients have really been surprised by loss of filler. All right, so we go through all those expectations and then we discuss the post-procedural protocol, which in many ways is one of the most important parts of this entire discussion. It's one thing I do a great job putting the filler in, which is very important, and I do that. But once the person leaves, that penis is going to become erect, it's going to retract, and we want the filler to stay in place, and we want to minimize bruising, we want to minimize swelling, and we want to minimize retraction of the penis. So excuse me, that's where we use, this is a patented sleeve by Falafel. And so we customize the size of the sleeve to fit the penis, and the person will just put this sleeve over their penis. Okay. This ridge right here helps prevent the penis from retracting into the sleeve. And this sleeve will provide compression to the penile shaft, minimizes bruising, minimizes swelling, minimizes penile retraction, helps keep that filler in place. Now, when we think about what we're actually doing with this procedure, we are injecting filler on either side of the penis. Okay, so sometimes I'll inject a little bit on top, but that's the minority of the cases. And then I'm not injecting on the bottom part because that's where the urethra is. So we're injecting on the sides. So some people might ask, well, will that make my penis look flat because you're only injecting on the sides? And the answer really is no. And I think a big reason, despite the fact that I'm typically only injecting on the sides, is that putting this sleeve on afterwards really helps round out that filler. What I've noticed too is even if there's slight unevenness or a bump or an irregularity involving the filler, continued use of the sleeve tends to even everything out. So the sleeve is very important. So my patients will wear the sleeve consistently for 3 weeks after the procedure before their next session. So it really is key. It's why we within Falafel tend to get really good results with our patients, because this post-procedural protocol is really on point. Okay, so once we go through all of those things, I will ask my patients if they have any additional questions or concerns, and oftentimes they have additional questions, which we'll address at that time. Then we'll go through a informed consent document. I'll give them as much time as they need to review that document, and then I'll ask them, would you like to have your procedure done today? And all my patients that have come in have decided to get their procedure done, that same day, with the rare exception of someone that I say, look, I don't think you're a good candidate at this time, or in guys who have had, let's say, erectile dysfunction, who have lost length and or girth, and they prefer to rehab their penis with something like a traction device or vacuum pump before doing filler. I'm totally fine in those circumstances saying, look, I think that you are a good candidate for girth enhancement, but why don't we rehab your penis first with some other tools to see if you can regain some size before I put filler in. So otherwise, most of the time, patients are coming in, they have the full consultation, and they're ready to proceed.